Well, I wish all the viewers a happy Teachers' Day and I welcome you all to classical conditioning theory. Classical conditioning theory was given by Ivan Pavlov in 1927. He was a Russian psychologist and he uses stimulus and response theory. He said that for every stimulus there is a response. If I prick your hand, you will withdraw your hand. So pricking is a stimulus, withdrawing is a response. For every sensation there is a motor or action. And he proposed a famous dog experiment which we all have learned in our school times, that he offered a food to a dog, then dog started salivating. Then he rang a bell in front of dog, there was no salivation. Then he combined food with a bell and then he saw that there was a salivation because of food. After doing it many a times, when bell was rang in front of dog, the dog started salivating. Okay, so what we have to understand this example is, we should know what is unconditioned stimulus, unconditioned response. We should know what is conditioned stimulus and conditioned. Now what is the dental application here? The application here that you can, when you record the past dental history in the performer of periodontics, it is very important to know that whether the child has a traumatic or a painful dental experience with any other dentist. If the child has that, then you need to decondition the child. Okay, so this is the application of this classical conditioning theory, importance of past dental history. We have four principles in classical conditioning theory. First is acquisition, second is extinction, third is generalization, and fourth is discrimination. Four principles. First is acquisition, second is extinction, third is generalization, and fourth is discrimination. What are these principles? The first principle, acquisition, means learning or obtaining. This is the meaning of acquisition. Response, when the conditioned stimulus is learned. What is unconditioned stimulus? When the food was given to dog salivated. Okay, so if you offer me gulab jamun or jalebi, I also salivate. If you are offered some good food, you also salivate. So it's natural. There is no condition about it. So that's the reason food is unconditioned stimulus. Unconditioned stimulus, the response is unconditioned response. When you rang bell in front of anybody, nobody will salivate. So bell is a neutral stimulus. When the bell was combined with food, the dog salivated because of food, not because of bell. And when it has been repeated many a times, when the dog was when the bell was rang in front of dog, the dog started salivating. Now the dog understands one condition, that when the bell is ringing, dog is getting the food. So the bell is a conditioned stimulus here because there is a condition. Bell is conditioned with the food. So when the bell is ringing, dog is getting the food. So this becomes a conditioned stimulus. What I mean to point out here is that bell, which was a neutral stimulus, has now been changed to conditioned stimulus. Bell, which was a neutral stimulus before, has now been changed to conditioned stimulus. Now, why we are teaching this example, dog experiment in child psychology? You can replace child with a dog here. You can replace the word dog with a child and replace the word food with injection or local anesthesia. So when child comes to you in the dental operatory and, for example, you have to do a pulp therapy, you need to give injection to the child or local anesthesia to the child. Child feels the pain or child may cry. Child feels the pain or child may cry. So injection is unconditioned stimulus because there is no condition about it. If you give injection to me, I also feel the pain, I also may cry. So it is natural. So injection or local anesthesia is unconditioned stimulus. Pain is unconditioned response. Next time child comes to the operatory, any doctor in white coat checks the child, there is no pain or no cry. Next time when child comes to the clinic, a doctor with white coat give injection to the child feels pain because of injection. And when this is repeated many a times, whenever the child comes, any doctor in white apron gives the injection, child feels the pain. A time will come when the child sees any doctor in a white coat, he starts feeling that this doctor is going to give me injection, and he feels the pain or he may cry or she may cry. This is the example of classical conditioning theory. Response when conditioned stimulus is learned is known as acquisition. Acquisition is learning or obtaining. So when the child learn or obtain the conditioned stimulus, the response after conditional stimulus is known as acquisition. Okay, child understood that every person in white coat can cause him pain. So the response is pain or cry to a conditional stimulus, that is white coat. That is known as acquisition. Extinction means reversal of acquisition. So extinction means removal. Response of the child when the conditional stimulus is removed. Response of the child once the conditional stimulus is removed and reverted back to neutral stimulus. How to remove this or how to revert it back? For example, child knows now every doctor in white coat is going to give him injection or he will feel pain to that white coat. Now we have to reverse this. For the reversal, what will we do? We'll remove the white coat and we'll check the child. Next sitting, we'll wear the white coat, we'll do the checkup. Then third visit, we'll wear the white coat, we'll do the scaling. Fourth visit, we'll wear the white coat, we'll do the initial restoration. Then we'll go for the moderate restoration. That means we'll do all the procedures where we are not going to give injection to the child. So the child will understand that this white coat is not causing him pain. This will reverse the conditional stimulus to neutral stimulus. This is known as extinction. Extinction, response of the child when the conditional stimulus is removed or reverted back to neutral stimulus. So this is, we have learned about acquisition, we have learned about extinction. Now third principle is generalization. Generalization means when a specific thing or a specific place is generalized or universally applied. For example, if I say that the dogs of Ahmedabad love berries. If I generalize this, I'll say the dog of whole world love berries. So this is generalization. If you look at this example of the dog experiment or the child experiment, we have learned that child understood that every doctor in white coat is going to cause him pain or give him injection. This is generalization. Okay. So if you looked at the scientific explanation of this, same response to different stimuli. Child is giving the same response, that is pain or cry, to bell as well as to the injection, to white coat as well as to the injection. So same response to two different stimuli is generalization. Discrimination is the reverse of generalization. When the child understands that white coat is not associated with pain. Child understand that that doctor in white coat caused him pain and another second doctor in white coat is not causing him pain. So this is known as discrimination. That means different response to different stimuli. Now the child understand that he is deconditioned and when injection was given, child feels pain. When injection was not given and white coat was used, child doesn't feel pain. So two different stimulus to two different response to two different stimulus. This is known as discrimination. So this is all about the classical conditioning theory. We have seen dog experiment, we have seen unconditioned stimulus, neutral stimulus, conditioned stimulus, unconditioned response and conditioned response. We have seen the dental application, that is importance of past dental history, and we have seen the four principles: acquisition, extinction, generalization and discrimination. Acquisition, we have seen that the behavior shown by the child once the conditioned stimulus is learned is known as acquisition. That means child understand that white coat people are going to cause him pain. So he learned, he behaved like that. Extinction means removal of acquisition. Response of the child or the behavior of the child once the conditioned stimulus is removed or the conditioned stimulus is reverted back to neutral stimulus. Okay, now we have reverted back and child understand that every doctor in white coat is not going to cause him pain. Generalization means same response to two different stimuli. When the child is conditioned, child feel pain when injection was given, child feel pain when white coat doctor was checking the child. So same response, pain or cry to two different stimulus. Discrimination means reversal of generalization. That means different response to two different stimuli. Different response means now the child knows that white coat is not causing him pain, so he doesn't feel pain to white coat, but he feel pain to injection. So two different responses to two different stimuli.